This is Dr. Arthur Perry. This is What's Your Wrinkle right here on WABC. And I've got a great guest coming up. Dr. Ramzan Zakir is a cardiologist. He's a cardiologist at Robert Wood Johnson University Hospital, and he is the director of the transradial catheterization at the hospital. Dr. Zakir, are you on the line?
I am.
Well, I want to thank you. You know, you were a guest of mine on that other station. We won't talk about that a few months ago. And you were such a great guest. I'm very, very happy to have you back. And we were talking last week, and, you know, your topic that you're going to talk about today is just fascinating. So you're using a new technology at Robert Wood Johnson to treat patients with coronary artery disease. Tell us a little bit about that.
Right. So the device is called the Diamondback 360 coronary orbital atherectomy system.
Wow. Wait a minute. say that one again.
Yeah. So it's a device that's used specifically for patients with coronary artery disease whose the arteries have a lot of calcium. Okay. And when patients have a lot of calcium in the coronary arteries, you know, it puts them at higher risk. It makes it more challenging to treat. Because these arteries tend to be, you know, it's a little more difficult to get the stent down. And even when the stent is in place, to dilate the lesion and expand the stent could be difficult. So that what the device does, it actually breaks up the calcium, and that allows you to get your stent into position and actually, you know, for the stent to be fully expanded. So in a nutshell, that's what it does.
It's really, really amazing. Now, you're very experienced in this technology, but pretty unique. I don't think it's around too many places. Is that correct?
That's correct. It recently got FDA approval, and, you know, we're one of the major launching sites in New Jersey. There's only one other hospital that's utilizing this technology.
All right, so now you're doing this wild and crazy technology that clears calcium from the coronary arteries. I find that absolutely amazing that you're able to do that and then put a stent in. Now, why is this technology such an important advance? You know, why is it different from the old techniques?
Well, you know, the prior technology, there was a system, an atherectomy device that, you know, to break up the calcium, but it had a very, you know, cumbersome setup. You have to have this, you know, a big nitrogen tank, and there's, you know, several steps involved, and you know, that kind of, you know, discouraged you know, some operators to, you know, in using it. It was kind of intimidating for the operator and intimidating for the staff that has to set up the device. And so, you know, a lot of people, you know, when they had these, you know, challenging calcified lesions, some people would, you know, refer to other operators, or they would even, you know, send them for bypass surgery. So now this device, you know, it's much easier to use. It's the setup is, you know, it's set up within seconds, and you know, you have a device that, you know, you could break up that calcium, and you know, a procedure that, you know, seems, you know, when you first look at it, it's very intimidating and very challenging. You've broken up the calcium, and you know, no, you know, 1, 2, 3, you know, you pretty much got your, you know, great result.
That is amazing. So now, does everyone that develops coronary artery disease get this calcium, or is it just a section, a section of people?
Yeah, you know, about, you know, calcium is probably present about, you know, 40% of the patients who have, you know, coronary artery disease. The device is, you know, the utility device, you know, we're estimating it to be, you know, even as high as up to 10% of patients who undergo stent placement.
Yeah, very interesting. My guest this evening is Dr. Ramzan Zakir, who is a cardiologist at the Robert Wood Johnson University Hospital in New Brunswick, New Jersey. Robert Wood Johnson, by the way, is in the geographic center of the state. If you look at the map of New Jersey and put your finger right in the center, you hit Robert Wood Johnson. And it's very easy to get to because there are the big roads all over the state lead right to New Brunswick. And, in fact, the hospital is just less than 100 yards from the train station that connects New York and Philadelphia and Washington. So it's very easy. If you live in Manhattan, you can easily get to Robert Wood Johnson. It's kind of like just getting in the subway and getting to your destination. It's the same thing if you want to go to Robert Wood Johnson. The phone number of Robert Wood Johnson is 888-MDRWJUH, MDRWJUH. There's a great website. I love this website. It's www.rwjuh.edu. I'll say it again, www.rwjuh.edu. So let me ask you, I've got you on the line. You're a great cardiologist. How does this coronary artery disease develop? Is it just because of what we eat, or is it who we are?
Yeah, I mean, a lot of it has to do with, the genetics and, some patients, come like, look, I'm doing everything right. I'm watching my diet and so forth. Why am I developing the disease? And, sometimes we have to say, well, you should have picked your parents better.
Yeah.
So, there is a huge genetic component. And then major risk factors are diabetes, hypertension. If you smoke, that's going to increase, your chances of developing coronary artery disease. So that's diabetes, hypertension, the lipids, and what we eat. Those are the major risk factors.
All right. Well, we all want to not smoke. Of course, that's the big one. That's the one we can control. And all those other things, exercise, diet, that's important. But if you do develop it, Dr. Zakir is waiting for you at Robert Wood Johnson University Hospital. Thanks so much for taking time on this Saturday evening, Dr. Zakir. We'll be talking again in the future, I'm sure. This is Dr. Arthur Perry, and this is